Well, welcome everyone. Let's go ahead and get started. I'm Mayor Kim Lund, the City of Bellingham, and it is my honor and privilege to welcome all of you to our city. So proud of Bellingham and so extraordinarily lucky to represent this amazing city. And in particular, we're here today in this space because we're in our downtown. And as mayor, I've had a particular focus on revitalizing and stabilizing our downtown core. When I took office, we were in the peak of fentanyl overdoses in this area. Whatcom County was experiencing crisis levels of fentanyl-related and opioid-related overdoses. But in this particular area, we were the epicenter of the crisis in Whatcom County. And so I issued an executive order in February to take some emergency stabilization actions. And those investments by the city are paying off today. We have established a community safety office downtown that co-locates our community paramedicine team and our GRACE alternative responders. We've had more than 400 hours of emphasis patrols from the Bellingham Police Department. We've collected more than 1 million pounds of solid waste from our alleyways. And the work continues. That's just the beginning. And what that has evolved into is our Downtown Forward strategic plan. So we have taken that foundation of safety and stabilization, and now we're looking forward to what comes next. What is the future and the unbounded thinking to really create a downtown where people want to live? There's affordable housing across the continuum, that it's a place where people come to work. It's the center of arts and culture. It's the downtown where we all go to celebrate life's special moments. And so that work will continue. But I want to acknowledge that the impacts of what I witnessed early on as mayor and going on those first responder calls to see what a fentanyl overdose looks like on the streets lingers with me today. And so I think it's just really important that we acknowledge that the impacts of this crisis have ripple effects in ways big and small. Of course, a primary concern is the people impacted with their addiction. It's their family members, the people that love and care for them. But what I also saw when I arrived on scene is the employees on the phone with 911 getting directions for the chest compressions and how they're not prepared in that moment to give that response. I saw the impacts. It stays with me. A new mother with her baby in a stroller who was just trying to navigate our commercial core stopped on the tracks and watching that overdose response with her newborn baby. And just the look on her face, the trauma of this ripples out in those ways, big and small. And that's why I'm so grateful that we're gathered here today, that we have continued focus on legislation and the supports that we need to address this crisis. And in particular, I just want to highlight that in a small cities partnership meeting with the other mayors and representatives from Whatcom County, Sheriff Tanksley came one day and he was talking about the funding challenges for the Interagency Drug Task Force and how we did not have the funding we need in this moment to have an adequate response. And the city of Bellingham, as part of my executive order, has rejoined Whatcom County's Drug Task Force. We have 2 officers committed to that now. And I just want to say good government looks like Representative Larsen's team being in the room to hear that need on this most local level. And now we have a response and a proposal at the federal level. And to me, I'm incredibly grateful for that kind of active listening and meaningful response. And so thank you, Rep. Larsen. It means a lot that you're putting these acts forward to support our communities right now. And with that, I'm going to turn it over to Representative Rick Larsen.
Thanks, Kim. Thanks, Kim, and thank you, everyone. I want to thank everyone for joining all of us today. It's good to see the tribal leaders here, the local leaders here, state government leaders, law enforcement, healthcare, other community partners from Whatcom, Skagit, and San Juan counties as well. Today is a day to reflect on and celebrate some of the progress that we've made, and look forward ahead to the important work that we still need to get done. Earlier this week, 2 days ago, in fact, I met with leaders and community partners from Snohomish and Island counties who, like you, are in the front lines of fighting the opioid epidemic. And the work that you've done, you are doing, that you will continue to do, is all very important to help our communities regain the momentum to combat this epidemic and to save lives. The opioid and fentanyl crisis is devastating Northwest Washington State. According to new data from the Centers for Disease Control and Prevention, overdose deaths are down by 10% nationally, but deaths due to fentanyl and other opioids are still on the rise in the West, up by 14% in our state since last year. But beyond the raw statistics, everyone knows someone or knows someone who knows someone, a family member, a neighbor, a community member, a friend, a colleague who's either struggling with addiction or has died. I met with many of you to hear your stories over the last year and a half or so, to better understand the loss that you endured, the challenges that you face, the tools you need to break down barriers to lasting solutions. And taking these conversations, I worked with my staff late last year to release a district-wide report that came out in January of this year that analyzed the regional crisis and offered federal policy recommendations to address many of your concerns. You won't be surprised to hear that the report has a 4-pillar framework, one that you all use probably every day. It just so happens that when you talk to everybody involved in fighting fentanyl and fighting the opioid crisis, we all come to the same conclusion. It's about prevention and education. It's about treatment. It's about recovery. It's about law enforcement interdiction. But all 4 of those pillars working together to address this crisis. So some of these needs are being addressed in legislation that has been already introduced in Congress. Other needs are being addressed by the Biden-Harris administration now, which has been a key partner. And just last week, the Biden-Harris administration announced $16 million to go out, including $290,000 for Washington State, to help disrupt illicit drug trafficking and drug-related crime through the National High-Intensity Drug Trafficking Area Initiative, or what we call HIDA, the HIDA Initiative. This Congress, though, I have worked to introduce 4 bills to address these 4 pillars. And the reason we're doing this week is because we just finally was able to introduce the 4th of 4 bills just on Monday during a pro forma legislation of Congress. And this week I introduced the bill, the Closing the Substance Use Care Gap Act, to expand access to life-saving community-based harm reduction initiatives and services, and enhance the federal response to opioid and fentanyl, the opioid and fentanyl epidemic. What we're doing is taking what we passed during the as part of the COVID response and make that a permanent authorization. Last month, I introduced a bill that the mayor mentioned, the End Fentanyl Trafficking with Local Task Forces Act, to help multi-jurisdictional drug task forces like those here in Whatcom County and Skagit and other counties to combat opioid epidemic and opioid trafficking in our state and across the country. In August, with the help of the Lummi Tribe and others, I introduced the Bipartisan PROTECT Act, which gives tribal courts and tribal law enforcement more tools and resources to combat the opioid epidemic. And in July, I introduced the Workforce Opportunities for Communities in Recovery Act to create jobs for people in recovery and to support communities impacted by opioid use. So you and I know we have a lot to do. And I could not have introduced these bills without your personal stories, without your continued feedback, and I will need your continued help to gather support for these bills to get them across the finish line. I did not come here to make any promises that they will pass by December 20th of this year when Congress gets out of session, but we are setting the stage to do the work through the rest of the year and in the future on these 4 bills, as well as the other work that needs to get done. So I want to thank you all for being here, being part of this, and allowing me to be part of helping you all and the communities I represent in fighting fentanyl and other opioids. Now, what I wanted to do next is to introduce a series of folks who will come and talk about the experience fighting opioids and fentanyl from their own perspective. And each of these perspectives will touch on elements of the legislation, of the pieces of the legislation that I've introduced. So therefore, our next speaker will be Lummi Nation Chairman Anthony Hilaire. The opioid epidemic has devastated our region, and we know tribal communities have been hit hardest. The Lummi Nation has been a steadfast partner in helping our office understand how we can help tribes combat the opioid crisis. And also Steve Edwards from Swinomish is here as well. And same goes for Steve and the Swinomish people, educating me on what the crisis has meant to them as well. Lummi is a key partner in developing the PROTECT Act. It's now my honor to introduce Chair Anthony Hilaire from Lummi. Thanks. Just take your time, I'll clean that up when you're done. Okay.
Siam Nostalgia, Tony Hilaire, Sunit Snat, Satsumton, Sunit Snat, Chuck Lummison. My dear friends and relatives, my name is Tony Hilaire. My name is Satsumton. I come from Lummi, chairman of the Lummi Indian Business Council. I'd like to thank you all for being here today. This is our home to the Lummi people. My great-great-great-grandfather, his name was Chilakosut, and he was born and lived at the village site where the Waka Museum is today, and also a signatory of the Point Elliott Treaty of 1855. And so this place is very, very important to us, and I really want to thank you all for being here today, and I also want to acknowledge Chairman Edwards from the Swinomish tribe. Thank you for being here. It's been tough, and we have seen so many tragedies at Lummi Nation from this fentanyl crisis, from this ongoing drug epidemic. I've witnessed mothers burying their children. I've witnessed children burying their parents, and even daughters this tall, pointing up to the screen, seeing her a picture of her dad, saying, "I want my dad back." And I've witnessed the deepest sorrow, the deepest cuts of grandmothers burying their grandchildren, having to say goodbye too soon. It's something that is very much a reality today, but it's something that we just cannot imagine ourselves. But I've also witnessed the beauty of resilience of the Lummi people, the mothers turning their grief into sincere hope for a better tomorrow, being there for each other, reaching out to others who are also grieving and are in times of sorrow, just being there for each other. I've witnessed frontline workers, first responders, law enforcement, and our community leaders, cultural leaders coming together to do everything we can to stop drugs coming on to our reservation. And we are a people of hope, and our hope stems from action. And as leaders, as many of you here today know, that our number one responsibility as a leader is to never take away hope from our people. And so we want to thank Congressman Larsen for his continued legacy of leadership, and he's survived many generations of Lummi leaders over the last couple of decades. My dad also served with Congressman Larsen at the same time. Really appreciate his leadership in defending our values of this place that we call home, as well as really providing hope. He talks about providing the platform and pushing it into this next legislative session, but at the end of the day, he's giving us some hope, and really cannot thank him enough, because that's how we get through these serious threats of drugs happening here in our home. Particularly thankful, just as he mentioned, the bipartisan legislation that in actuality, it's about honoring tribal sovereignty and self-determination, our ability to take care of ourselves, to know that we know how to take care of ourselves is really important, and that's what this legislation does. It's a step towards our ability to have sole jurisdiction, or even the ability to work together on the complexities of multi-jurisdictional issues, that we can really go after tribal predatory drug dealers that are targeting our reservation, as seen in the recent federal arrests that happened just weeks ago. We really want to take care of our people, take care of our children. And us being here today, this time to honor and acknowledge the good work of Congressman Larsen, really, it stems from us being together. And today we stand united, all of us, for the grieving children, for the grieving mothers and fathers, for the grieving grandparents. And we say to the predatory drug dealers, the drug traffickers, the drug cartels, that their drugs are not welcome here in our home. We say to the people that are struggling with addiction that we love you very much and that we're always, always going to be here for you. And we say to the frontline workers, the first responders, that you have our undying support in addressing this issue. And we say to the world, we say to everybody that calls this place home, that we love you very much and that we appreciate each and every one of you. On behalf of the Lummi Nation, we want to thank you all for being here. Thank you all for this step towards partnership and working together to change the world, to be a part of something much greater than ourselves. I want to thank Congressman Larsen for really being a beacon of hope for the Lummi people and all residents here in Washington State. Haishka Siam Nostalgia. Thank you.
So there's a lot of people here who won't be speaking, but do a lot of work at the state level. Sharon Shoemake, State Senator Sharon Shoemake is here, and Joe Timmons I saw walk in somewhere. There he is, Joe's. Yeah, there. Joe Timmons is here as well. There's other folks. We'll get to them. You'll get your turn, but I would just want to note, to combat the opioid epidemic, there has to be the strong partnership between federal, state, tribal, and local governments. And here in Whatcom County, communities have been really hit hard by the opioid crisis. And earlier this year, Whatcom County enacted its first fentanyl operations plan to create a comprehensive approach to combat the devastating effects of fentanyl and other opioids from multiple agencies. And so I want to invite now Whatcom County Executive Satpal Sidhu to come forward and speak about that. Thanks.
Thank you, Mr. Larsen. Thanks for everybody to come here today. This is a topic which is bigger than all individually for all of us. And that's the only way that we have been able to do whatever we could. It's not enough, but we have done a lot. And thanks to Mr. Larsen that he was with us not too long ago, talking about the drug force, how Bellingham joined into the drug force task force, and what resources can be given to that, because these are the fundamental things we need to change or stop this proliferation of drugs in our communities. And I want to thank Mayor for taking that step of issuing the executive order, and Chairman Hilaire working together when all these, like in a week, children dying, parents dying for their children, and it was devastating. And our council was magnanimous to put in quick action. Let's do something about it. And we passed a resolution. They asked that county executive to issue an executive order, which I did in April. And we have put a few $1 million behind it. It's not only a piece of paper that we put out that this is what we want to do, but we wanted to actually put resources behind it with the help from the council. And our health department has has built an operations plan, which we are implementing and doing whatever we could. The other thing is the chairman of our county council and Nick Lewis, member of LIBC, Lummi Business Council, they went to Washington, D.C., and they had NACO, National Association of Counties, adopt a resolution about fentanyl being a crisis for the whole nation. And I think these are the steps we can make. More we can make people aware, the governments at local, city, county level, of what is going on, and getting a corresponding assistance, help from the federal government is very important. We are expanding on the LEAD program. That's law enforcement assisted diversion. So many acronyms to remember, which is making a difference. We have started alternate response team. In collaboration with the city. I mean, this is the things that what I think the bringing results is us all working together on these issues, which are not limited to one community or one place. And the county has distributed more than 5,000 doses of naloxone in just in 2024. We have installed free vending machines for naloxone in different places in our county. And of course, we are working with state representatives also, and Alicia, that what we can do to further combat and what resources we can put in to do that. And that I just want to talk a little bit about the 23-hour crisis relief center, where we got help from the state, Alicia, Joe Timmons, and Sharon, and they were all worked together to bring that first facility in Whatcom County, and we are ready to break ground next year, and it will be operational in 2026. And at the same time, waste station. Like, there are several steps of institutions you have to build. It's not having just one place and it'll fix it. There are different levels of response. We need different institutions or helps. And waste station, that's another element where Mr. Larsen walked in with a $2 million check. He said, here it is. Very grateful. And Sharon worked on to get very first $4 million for that facility. And we're excited that the county is putting on more money into that, and city, and now we are asking our other partners to participate in with us combating these things. So I just want to say thank you to the council, thank you to Mr. Larsen and cities and Lummi Nation and Nooksack Nation and everybody else. I think same thing is happening in other counties as well. This is something we have to deal with as a combined community, as combined as a state. Thank you very much for all the work you are doing. Thank you.
First off, I just want to lower everyone's expectations that I just don't come in with a $2 million check. If you ask, there's a lot of steps to get to that point. Just so. Now the $4 million from Sharon, it's like that. Yeah. Before I introduce San Juan County Council member Cindy Wolf, there's other local electeds here as well. Kaylee Galloway is here from the County Council in Whatcom County. Dan Hamill from the City Council is here. Thanks, Dan. And several mayors. Mayor Jill Johnson from Cedar Woolley, the Grand City of Cedar Woolley. Greg Hansen from Ferndale is here. So Scott Hordice from Linden. Thanks for coming, and wearing a tie for me. Yeah. He's like, yeah. Told him, yeah, you come to Bellingham, you got to wear a tie. Yeah. And I saw Mayor Peter Donovan last night from the city of Mount Vernon. He couldn't be here, but Steve Sexton is here, and he's special projects for Peter. And thanks for coming by. And am I missing any elected officials? Sorry. Oh, there we are. Okay, yeah, Bill Hazlitt, the new mayor of the city of Burlington. Thanks, Bill, for coming. I appreciate it very much. And there's one more, Cindy Wolf. Cindy Wolf is a county council member, one of the county council members from San Juan County. And although we're here in Whatcom, my district includes Skagit, San Juan, Island, and Snohomish as well. And each of these counties have been deeply impacted by the crisis. And so I asked Cindy to come because she serves as that county, San Juan County's representative for the North Sound Behavioral Health Administrative Services Organization. Back in my day, when I was on the county council, it was the RSN. It's gone through like 4 name changes to get where it is today. But it's changed because how we address behavioral health and substance abuse, chemical dependency has changed over that time as well. And so the ASO provides behavioral health services for Northwest Washington. So I asked Cindy to come over, and thanks for making that trip. I know it's not easy, but thanks for coming to Bellingham to join us, and I'll turn the microphone over to you for a few moments.
Well, Congressman Larsen gave you a pretty good bio. I also serve as the alternate on the Criminal Justice Treatment Account panel for Washington State Association of Counties. And once upon a time, I was a 23-year-old in Los Angeles answering the phone when my darling 6-year-old neighbor called to ask me if she and her 3-year-old sister could come stay with me for a few days while their father detoxed in the back room of their house. And I could hear him screaming in the background at the demons that were torturing him. And I opened my door. Back then, the only recourse for him was basically to detox himself and then seek help and methadone, and he was able to stabilize his life. He never did get off the methadone, but he was able to hold a steady job. I want to thank Representative Larsen for the leadership shown in this perceptive legislation. The opioid crisis in a tiny county is in some ways very similar to the experience of any rural, remote community. In fact, there was a delegation of young people from Lummi at the last National Association of Counties meeting that I got to talk to for a while. And we spoke about the fact that among other challenges that are exacerbated by physical isolation are the fact that sometimes the children in the family are the only ones within a 10-minute response time when there's an OD occurring. And that's very real in terms of naloxone, who's got access to it and who's trained. And that's unfortunate. In this kind of an isolated situation, it becomes very stark and very apparent how important harm reduction strategies are, and that they really are the difference between life and death. For a tiny county, the opioid settlement money doesn't go very far. Our first settlement money was about $15,000 a year. And you can imagine about how far that goes when a box of 100 test strips for fentanyl contamination costs $1,400. So, much appreciated. I saw the part in the bill where that money can be spent in buying those test strips and buying that naloxone. I'm going to finish up with a story of a father that was shared with me by our juvenile justice administrator just recently when I was prepping for this. He lives in his car with his family, and he was at the point where he was having to take fentanyl every 20 minutes just in order to walk. And he finally decided that he was done. So he came into our office. CPS was ready to take the kids. He was lying on the floor as sick as he could be, and our staff moved heaven and earth. And we are so grateful to our regional partners because we depend on regional partners for detox beds and for medically assisted detox for longer term treatment beds. And we don't have anybody in our county who is certified for medically assisted treatment. So the staff did move heaven and earth, and they got him off island, and they got him a bed within 24 hours. And those of you who work in this field know that your optimal window is probably about 8 hours when somebody says yes. But we got him there. And they helped him when he got out. They got his car cleaned up, but he's facing some other issues that your leadership will help to address. He needs a place to live. He needs a job. He needs a place to be that is outside of the matrix of the place where he was addicted. And that, again, is a place where regional cooperation can mean so much. We could actually do something with regional housing, and we've talked about this in the NSBHAS. So maybe what we do is we set up a situation where there is housing and job opportunity, and we can move people from where they were to where they need to be for their recovery effort with supported housing. So with that, again, a big thank you, and I appreciate your time today.
Thanks, Cindy. So 3 additional speakers, and to get sort of into some of the legislation that I've introduced. But in Skagit County, Peter Maturko serves as the community health coordinator, and in that role, he leads Skagit County's opioid response and outreach efforts, including the prevention and awareness campaign, and the county's distribution of naloxone, a medicine that we know rapidly reverses an opioid overdose. And naloxone distribution is a part of the harm reduction that could be supported through one of the bills I've introduced, the Closing the Substance Use Care Gap Act, which again was the bill that introduced on Monday. So I want to call Peter up here to talk a little bit about his work in Skagit. Thanks, Peter.
Hello, everyone. My name is Peter Maturko. I'm a community health coordinator with Skagit County Public Health. Before moving to Skagit County Public Health, I was a case manager for Northwest Youth Services at 22 North. I was a street outreach coordinator for Northwest Youth Services, so familiar with this area and some of the issues. And speaking to that direct work and that direct service, it was always really heartbreaking working with one of my clients or somebody out in the streets who was doing their best to detox themselves or experience withdrawals, and just wanting to do it cold turkey and not enter a system where they're going to be stigmatized or treated poorly. So my heart always went out for that. Since other folks were telling personal stories, I thought I'd introduce that, but otherwise I like to appear polished and concise, so I'll stick to my script here for the remainder. Thank you for inviting Public Health to speak on these important issues. As everyone else here can attest and has attested, the challenges for opioids and fentanyl are quite severe and significant. So receiving funding and support from the state and at the federal level has been really crucial for us locally in Skagit County. And I want to provide a few examples of where we've tied upstream funding down to local harm reduction and prevention efforts. So bear with me, I'll try to do as well as I can with the acronyms. Rick Larsen's great with them. I should know mine. So first to start, Skagit County's mobile outreach syringe exchange program utilizes harm reduction practices to meet rural and underserved communities where they're at. So these folks drive around, they're out all around Skagit County from East County to West. And in addition to providing or exchanging needles, handing out test strips, naloxone, wound care kits, they really are critical in building and maintaining meaningful connections with people who use drugs and supporting them in staying alive, in service engagement and referrals when they're ready to take that step, and generally just navigating the stigma and external barriers that these folks face everywhere else in the community. Our syringe exchange program is funded through the state at the moment, but before they were incorporated as a Skagit County program, they were funded through SAMHSA. More recently, we launched SkagitRising.org, which is a prevention and education initiative made possible through CDC's Overdose to Action grant. This website provides critical substance use, harm reduction resources, and information on how people in Skagit can learn what's available locally for them, and also how they can obtain naloxone and fentanyl test strips for free from Skagit County Public Health. And as a more recent update, we were just awarded another version, OD2A State, Overdose to Action State, to help us bring our website up to date and to rebrand it and get more material out there to promote it in our county. And lastly, my third example here, but not leastly, is that Skagit County is a recipient of nasal naloxone allocations through the Department of Health's Overdose Education and Naloxone Distribution Program, the OEND program, which provides and supports access to free naloxone for folks that are likely to experience or witness an overdose. So through this partnership with DOH, our Public Health Community Services Division, so a small group of folks in our division have been able to hand out over 3,085 naloxone kits in the last few years. Speaking for the county, in 2024 alone, we've handed out, to date, 3,694 OEND kits, us in partnership with other OEND partners in the county. So I see Steve Simmons over here, who's outreach manager with Community Action, Skagit County. He's one of our partners that hands out naloxone. So this is a lot of naloxone going out to the community. And what we know, what these numbers are telling us, is that we are successfully distributing naloxone at scale, countywide, to meet the saturation rate needed to reduce deaths from opioid overdoses. So that is a great tool, and I think small victory for us right now. But there is still much work to be done, and that's why we're all here. But we're confident that through the continued collaboration support with our regional providers, our local electeds, and Rick Larsen here, that we'll be able to turn the tide on an opioid crisis in Skagit County for our region and for our state. Thank you.
Thank you so much for that. Speaking of Skagit County, I was in Skagit County yesterday with the what they call it SCADU, which is the Skagit County Interlocal Drug Enforcement Unit. Speaking of acronyms, I've been in Congress so long, 24 years, that I've seen the same acronym used across agencies for totally different things, so I get mixed up. That's why I really ask people, like, try not to use acronyms because I don't really know what they mean. But the Skagit County, I met with the Skagit County Interlocal Drug Enforcement Unit to get a briefing and update from them on what the experience has been in Skagit. And there's some steps, positive steps have been taken, but fentanyl and other opioids are still in the community, and newer, I forget what they're called. They're not opioids, but xylazine and nitazine, and as I said, and the other zines are showing up now as well. And so this work with the multi-jurisdictional drug task forces is important, and I'm really happy to hear the city of Bellingham is back in. It's great here in Whatcom County. But the work of these drug task forces is extremely important in holding accountable the people that are bringing these dangerous drugs into our communities as well, and that has to be part of it. So I asked Deputy Chief Eric Francis to come and talk a little bit about what Whatcom's doing, because they were pivotal partners in helping us draft the End Fentanyl Trafficking with Local Task Forces Act. So turn it over to you, Deputy Chief. Thanks.
Hello, everybody. Thanks for inviting me here today. I appreciate it. Sheriff Tanksley couldn't make it. Unfortunately, he was busy today, but he asked me to step in, so I'm happy to do that. Mayor Lund, it's the first time I've seen you, and hopefully get a chance to meet you. I appreciate your efforts, as well as Chief Mertzik. Where is she? There she is. Yeah. To give you an idea, Skidoo, Representative Larsen mentioned Skidoo, the Skagit County Drug Task Force. I worked with those guys 20 years ago. The sergeant in place is still there, and they do outstanding work, excellent work. Had to give a shout out because they deserve it. To give you an idea and some context of our drug task force, we have 3 detectives from Sheriff's Office, 1 sergeant, and then newly appointed sergeant from the police department and detective. So 5 total. We also have collaboration with Homeland Security. We have a detective that works with them directly. And 2 of our, actually we'll have 3 detectives will be task force officers with the DEA. So we rely on DEA for a lot of their resources. We work with them daily. As a matter of fact, we're in their office right now. A little more context, Mayor Lund had mentioned the overdoses. I remember when I was in detectives not too long ago, and the talk of fentanyl would come up, and nobody really even knew what that was. It was not mainstream. It was not anything like what we're experiencing now. And it just literally exploded. There was a 3-month period between January and March of 23. This came from our crime analyst, 24 overdose calls just in downtown Bellingham alone. So this general area. That same time period, 1 year later, 63 overdoses. And that was about the time that we started having serious talks with the mayor and police chief about bringing Bellingham Police onto the drug task force. And it happened much quicker than I would have anticipated with considering how government works sometimes. But they came over, they've been here now for, I think, 2 months. And I just wanted to share some statistics to you. I don't want this to be too boring. But March of this year, Drug Task Force served 2 search warrants, made 5 arrests, and seized 3¼ pounds of fentanyl. That was here in Whatcom. In May, they started a brand new investigation, 3-month-long gun fentanyl investigation. There were 3 locals, 2 in Bellingham, 1 in Whatcom County, that were arrested. That resulted in a search warrant, 2 search warrants down in Everett, where 24 pounds of fentanyl, 32 pounds of fentanyl-laced pills, 12 pounds of methamphetamine, 3 pounds of heroin, and $60,000 in drug proceeds were seized. And that was just in one 3-month investigation that all started up here, where a lot of that fentanyl was coming this way. I wish I could say I had something to do with it, but I didn't. It was all our detectives that did great. In September, again, I won't bore you with too many details, but I think this is important. In September, there was another warrant that was conducted in Whatcom County. 2 more arrests, and 3½ pounds of fentanyl were seized. And then just 2 weeks ago, this is a huge case, Eastern Washington, our drug task force had intel about some trafficking that was going on down in the Phoenix area, and the fentanyl that was coming up from that area was directly headed to Whatcom County. They pulled over a subject with 50 pounds of fentanyl. So it's coming up here because it's cheap and it's readily available, and we're doing everything we can to combat that. Just another side note here, just 2 days ago, one of our canine officers went down to Snohomish County because Snow County had run out of canines, and our canine went down there and did a sniff and located 10½ pounds of fentanyl. Somehow it had some kind of connection with Whatcom. So again, it's cheap. It's not just coming from Mexico. I talked to Customs and Border Patrol intel just 2 weeks ago, and they indicated that the fentanyl labs up in British Columbia are exploding right now. So some of the fentanyl we're going to start seeing on the streets here is not coming from Mexico. It's coming from British Columbia. Right now, we rely greatly on a $150,000 grant from the Department of Commerce. But this, we greatly appreciate the work that Representative Larsen and his team is doing, and any federal help would be much appreciated. So thank you.
Thanks. And if I'm not mistaken, that State Department of Commerce money is pass-through money from the federal government, and through the Burn Jag program. And the challenge was last year the governor chose to use some of that Burn Jag money legally and within the scope of what it can be used for, but it diluted the total use of the money for Burn Jag. So less got directly to the operations of our drug task forces. And so as a result, this legislation we've introduced is to try to create a dedicated funding stream for drug task forces around the country. I will say as well that that work also resulted in the state legislature stepping in to support drug task forces through the June of next year. And so we need to act quickly at the federal level to be sure that those dollars keep going. And we talked about the drug task forces, talked about the PROTECT Act, which is hoping we can close the door that the cartels are using to come into the reservations, knowing that the tribal governments and law enforcement don't have the same enforcement authorities as non-tribal law enforcement. So we want to close the door with the PROTECT Act. Got the workforce bill to help people who are addicted to get recovery, treatment and recovery, and get back in the workforce as well. And then the harm reduction bill that Peter talked about. So all this kind of comes into, we're trying to bring it all together here for everybody, at least how we're thinking about it in my office, where the community partners are really the backbone of the response to this crisis. And that's why our next speaker, Lisa Nelson, I invited her to speak as Chief Pharmacy Officer for Unity Care Northwest. Earlier this month, as Paul mentioned, I joined Unity Care Northwest, and many of you in this room and others, to the ribbon cutting for the Way Station, which provides medical respite, hygiene. It's a hygiene center. It provides healthcare, long-term housing support, and case management for individuals and families experiencing homelessness. And so, if Lisa could come up and join us and say a few words. Thanks.
Hello and good afternoon. For those of you who I have not yet had the pleasure to meet, I'm Lisa Nelson, Chief Pharmacy Officer at Unity Care Northwest. I want to start off with by saying that I appreciate the opportunity today to be provided with a few minutes to speak to the harm reduction work being done by Unity Care Northwest. Members of our organization leadership have been involved in the Whatcom County Opioid Risk Reduction Task Force and Whatcom County Multi-Agency Coordination Group. Many years ago, we were at the forefront advocating for safe medication disposal to ensure that members of our community have a low barrier mechanism to safely dispose of opioid medications, getting the unwanted medications out of medicine and kitchen cabinets, and reducing the risk of diversion and misuse. Our work from there continued, and in 2018, our behavioral health team began offering substance use disorder services, including medications for opioid use disorder and counseling with substance use disorder professionals. When it was identified that the need for medication for opioid use disorder was greater than the capacity of our behavioral health team, Unity Care expanded to include access to medications for opioid use disorder services by our primary care providers. We've been active in increasing nasal naloxone access to our patients, and thanks to the federal 340B program, we continue to be able to provide naloxone to our patients at no cost to them. We have naloxone distributed throughout our health center, and Unity Care team members have utilized naloxone many times, saving lives both within our facilities and in the surrounding areas. Our work will expand with the opening of the Way Station, where we will offer substance use disorder services and an access point for referrals to our growing medication for opioid use disorder program. We also know that in Bellingham, there are 20,000 residents who are low income and not served by a community health center. As part of Unity Care's strategic plan to meet the needs of the community, we will soon begin a capital campaign, wink, wink, to expand services in a building that we have purchased. We know that the need for all services is so great, and when complete, this expansion will increase access to medication for opioid use disorder and substance use disorder programs at Unity Care Northwest. We are encouraged by Representative Larsen's work in battling the opioid crisis, and when passed, the Closing the Substance Use Care Gap Act will be another tool in our toolbox, providing both funding and support, ensuring sustainability of the programs that we have built. If we are going to be successful in overcoming the opioid crisis, we are going to need federal support to do so. Thank you, Representative Larsen, for all that you do to provide the resources and assistance that our community so desperately needs.
Thanks for coming. Well, that about wraps it up. There are two other folks I wanted to introduce. Councilmember Todd Donovan from the County Council was here as well. And did I see Alicia Rule? Alicia, there you are. There you are, Alicia Rule. State Representative is here as well. Thanks for coming. So a couple of words that I want to kind of leave you with. One is momentum. One of the reasons we did the report in last year and then released it earlier this year is thinking back to pre-COVID when we passed the Comprehensive Addiction Recovery Act in 2016 and then began to fund it over the next 4 years, really creating the foundational federal tools that the states like Washington State are using. So when you get a state treatment grant, that's actually federal money that goes through the state to a local area to develop a treatment center, some of the recovery dollars as well, these other treatment dollars. And as well, for the most part, there was a general consensus, at least in my district, I sense that there are certain places for the people who bring these drugs in our communities, and that's called jail or prison. And there are other places for people who are addicted, and that's called a treatment and recovery center. And folks understood that. Folks really understood that the folks who are addicted, that's a disease, it could be treated, and the folks who are bringing in the drugs are a disease, and they need to be treated otherwise. COVID came and kind of all that fell apart. So I saw it fall apart through all our community because all these treatment modalities really required people to be together. Telehealth was helpful, but it's not the same thing. So a lot of these connections began to fall apart. And so what I was hoping to do with this report is rebuild some of that momentum that we had before COVID. I'd like to think that because of the staff work that we're part of getting that momentum back. Obviously, the work that you all do is getting that momentum back so that we can work together in treatment and recovery and prevention and interdiction to really address the opioid crisis in our community now and in the future. So that momentum is important. The other word someone used, and I've heard a couple times, is hope. That this gives, working together gives everybody hope that we can address these issues and address them together. We want to continue to be part of this, part of this work in the community. Next year and the subsequent years, this will be fighting fentanyl and other opioids as well as whatever's coming next will continue to be a part of what my office does. Both in DC as well in the district offices. This will be you'll not only hear me talk more about transportation, because you always hear me talk about transportation, you'll also hear me talk about and act on supporting the communities that I serve in addressing the drug epidemic in our communities in a comprehensive way and in support of you. So together, we can move these bills forward. I'm going to need your help to do that. We're going to take a run at a few of these bills. At least the legislators know this. Sometimes you introduce legislation in order to get the government itself to move, to get the agencies to move. And so introducing these bills between now gives us the opportunity to push the agencies at the federal level to move on these issues while also setting the foundation for doing something more long-term as we get back into session next year on January 3rd. So I appreciate you all coming out today. Thank you very much for your time. I'll be around mingling a little bit, as well as my staff will be as well, and they will go up to you and actively introduce themselves so you know who they are. And thank you all for your work And thank you for coming out. Thanks.